Hi, I'm Dr. David Greene, CEO of PainManagementLasVegas.com, where we bring you anything and everything education for pain management. Today the topic is the facts on narcotic prescription drugs. And some of these facts will blow you away. They are startling and will basically show you what an epidemic we're dealing with in this country. And I'll just start to delve into these and you'll see what I mean very quickly. Every 14 minutes, somebody in America dies from a prescription drug overdose. And a significant amount of those are narcotics. Okay? Now, about 20 to 25,000 people die every year in America from a narcotic overdose. And when you look at that number, multiply it by 30, so you get to 600,000 people. That's how many people end up in an emergency room from a non-fatal narcotic prescription drug overdose. So that is incredible. They're either getting their stomach pumped or something in the ER, to prevent the fatality. So unbelievable. Vicodin is the #1 prescribed drug out of all others in America. And doctors write about 300 million opioid prescriptions every year. So if you figure there's 330 million people in America, about 30 million are kids, that means there's about 1 prescription for every adult in this country for narcotics. That's the ratio this way. In the 1990s, there was a big push in the VA health system to treat pain humanely, and they wanted to call it the 5th vital sign. And between 2000 and 2010, Congress pushed for the decade of pain control. So the amount of narcotic prescriptions that were written went up by 4-fold, so a factor of 4. Some of that was obviously indicated. I mean, it was felt that in this country pain was being undertreated. Well, I think it's safe to say that in a lot of instances now it's sort of being overtreated. Or a lot of these narcotics are being used for non-medical reasons. 10% of high school seniors have tried Vicodin, and I can tell you that 10% of high school seniors do not need Vicodin. 6 million Americans abused prescription drugs in the year 2010. So that's about 2% of adults who have abused prescription drugs. 42 tons of hydrocodone were prescribed in the year 2010 between pharmacies and hospitals and doctors' offices. And 69 tons of oxycodone were prescribed in that year. So the numbers just stagger you and make us realize that something needs to happen. Now, the best pain clinics in the country and the best pain clinics in Las Vegas, they do multiple things. They do urine drug screening, they do opioid agreements with their patients, and they also check a pharmacy database to make sure that patients aren't doctor shopping. And some of them offer additional things from medications, such as chiropractic, physical therapy, interventional pain treatments like epidural injections, facet blocks, radiofrequency ablation, those kinds of things. So when you're looking for a pain clinic to go to, make sure you do your research and look to see if the doctors have training, either board certification or fellowship training, and it's a lot of their practice. You want to go to someone who does that for a living. Check out our website at PainManagementLasVegas.com. There's a ton of education on there and just a lot to learn about various pain conditions. Remember, knowledge is power. So I'm Dr. David Greene, CEO of PainManagementLasVegas.com. Your pain stops here.